Visceral fat explained, the hidden fat that increases your risk of heart disease, diabetes, and cancer. What if one simple measurement around your waist could reveal your future risk of heart disease, diabetes, and even cancer? Not your weight, not your BMI, just your waist size. This isn't about appearance. This is about a hidden fat deep inside your body that silently disrupts your metabolism and damages your organs. And today, you'll understand exactly why abdominal fat is far more dangerous than most people realize. Abdominal obesity refers to excess fat accumulation around your abdomen, especially fat stored deep around your internal organs. This is called visceral fat, a waist circumference of 90 centimeters or more in men and 80 centimeters or more in women is considered abdominal obesity. And here's the important part. It's not just how much fat you have, it's where that fat is stored. Fat stored in the abdominal region is biologically active and strongly linked to serious chronic diseases. Unlike fat under your skin, visceral fat actively interferes with your body's normal metabolic function. It causes harmful metabolic changes, including increased triglyceride levels, increased release of inflammatory substances, insulin resistance in the liver, increased production and secretion of very low-density lipoprotein particles, increased small, dense LDL particles, which are more harmful, and reduced HDL cholesterol, the protective form of cholesterol. These changes significantly increase cardiometabolic risk. This is why visceral fat is far more dangerous than total body fat alone. But here's what makes this even more concerning. Visceral fat doesn't just sit there. It actively affects your hormones, your liver, your blood vessels, and your entire metabolic system, often for years before any symptoms appear. Many people feel completely healthy while this damage is already happening silently. Several factors influence visceral fat accumulation, including age, genetics, gender, ethnicity, hormonal influences, and dietary factors, especially excess calorie intake. Hormones such as cortisol, sex hormones, and growth hormone all play a role in determining where fat is stored. Additionally, abdominal fat cells have unique biological characteristics. Their size, number, fat storage capacity, and inflammatory activity directly contribute to increased cardiometabolic risk. Visceral fat is strongly associated with increased risk of cardiovascular disease, type 2 diabetes, liver disease and cancer, and metabolic dysfunction. This happens because visceral fat promotes inflammation, disrupts insulin function, and alters lipid metabolism throughout the body. Over time, this significantly increases disease risk. In clinical practice, measuring waist circumference in addition to BMI provides a more accurate assessment of cardiometabolic risk. Two individuals can have the same BMI, but very different health risks depending on how much visceral fat they have. This simple measurement can help identify high-risk individuals much earlier. Here's the encouraging part. Multiple lifestyle interventions, especially weight loss through low-calorie balanced nutrition, combined with moderate and vigorous intensity regular physical activity, can effectively reduce visceral fat. In fact, visceral fat is often one of the first types of fat your body reduces during weight loss. However, weight regain is common, especially in individuals with a genetic predisposition to abdominal fat accumulation. This highlights the importance of sustainable, long-term lifestyle changes. So let me ask you one final question. If your waist measurement could warn you years before serious disease develops, would you pay attention to it? Because abdominal obesity is not just about body shape. It is an early warning sign of deeper metabolic risk. The earlier you recognize it, the more power you have to prevent serious disease. Your waist circumference is more than just a number. It's a signal, a warning, and an opportunity to protect your future health. Stay informed, take action early, and take control of your health.